Welcome back. We have Dr. Harpreet Lotay joining us from Sona MD. It's great to have you back on the show.
Great to be here, Susan.
We're talking about the basics of skincare, the things that you really need to sort of dumb it down to when it comes to the important things you should be thinking about.
Absolutely. I think, you know, one of our philosophies at our clinic is to make sure that we educate our patients about how to take care of their skin and really approach things in a preventive way. Especially this time of year, you're out and about, you're looking at skincare products, and there always seems to be the latest or greatest ingredient that all the skincare lines are putting in. And I want to make sure that we're giving our patients the information they need to make sure they're investing their money properly. And you don't want to throw the baby out with the bathwater in terms of grabbing onto a new ingredient and letting go of the things that are really important.
Absolutely.
So I thought today would be a great opportunity to go over that. So the 4 things that I like to really focus on when we look at skincare is, first of all, prevention, and then making sure that the ingredients that are in your skincare line are actually doing something for you, that there's clinical data behind what you're putting on your face.
Okay.
So when it comes to prevention, we're talking about sunscreen. And the 3 other ingredients that I like to focus on is retinol, and then antioxidants like vitamin C, and then fourthly, growth factors and peptides. And I usually tell people, you know, whatever your budget is, go in that order. First, invest in a really good sunscreen, and then a retinol product, and if your budget allows, move to the next step.
Okay.
Because when you look at the clinical data out there, the most that we have for is the sunscreen in terms of prevention, and then retinol. And vitamin C will help with collagen production and antioxidants and so forth. So I know it's winter, I know it's a snowstorm out, so it's an unusual thing to focus on, but sunscreen is key, because we know that 80 to 90% of aging is influenced by radiation or sun exposure. So if we can prevent the enlargement of pores, pigment changes, fine line and textural changes, we're way ahead of the game.
And that can all be reduced substantially by a good sunscreen.
Absolutely. When we're looking at sunscreens, I tell people, look for a physical sunscreen. And what I mean by that is one that's really made up of micronized metals, so zinc or titanium in a micronized form, so that the radiation is reflected off of your skin. The chemical sunscreens really do rely on a chemical reaction. Going back to high school physics, you know, one form of energy can be transformed into another. We have radiant energy from the sun that's absorbed by chemicals, and then a chemical reaction happens in the skin, and it's transformed into heat energy, so the radiation can't affect your skin's DNA. So that's how the chemical sunscreens work. The physical sunscreens just basically reflect the sun's rays, which I think is better.
Okay, give us a couple quick examples of what those look like.
So the key thing is to really focus on going with a sunscreen that you can use, that you like on your skin. So that's key. So we have this sunscreen primer that works 2 functions. It basically allows your makeup to go on in a really smooth fashion. So it's a twofer, and it lasts about 8 hours. So I like that, because chemical sunscreens are meant to be applied, you know, every 2 hours. Nobody does that. This you can leave it on.
And it'll go all day.
And this particular one is great for people who don't like to wear makeup. It starts out white. It's also titanium and zinc, but as you rub it, it will blend into your skin color.
Yep, and it totally does.
Yeah.
Love it.
Yeah, so that's great.
We're down to about 1.5 minutes, so I don't want to...
Sure. So this one is a powder sunscreen. So this is great for people who don't like to have the feel of anything on their skin.
And some don't.
Yeah. So, you know, find a sunscreen that you really like, and then move on to a retinol, which is a vitamin A derivative, and it'll help your skin function better from a physiological perspective. What I like to encourage people to do is bring their skincare in, come talk to us. We'll go through those 4 basic things that you want in your skincare, and we'll help you. And we have kits that actually cover all of those basics, so you don't even have to
think about it.
And so that's a good opportunity. And if you come in, we also, when we do your consultation, we'll give you a link to a PowerPoint presentation that I've created that actually goes through those 4. So you can be better educated about these things.
Okay, so first up, good sunscreen. Second up,
Retinols.
Third one, vitamin C.
Antioxidants, and then growth factors. And tomorrow is a great opportunity for people to come in and visit us too. It's our anniversary. From 5:30 to 8, come visit with us. We'll give you some more educational information.
Fantastic.
And it's a great opportunity to save too, because we'll be having gift cards that will give you 15% off of any of our services.
That's awesome.
All year. So
that's great.
Yeah.
Never a bad time of the year to be thinking about good skincare. It doesn't matter if it's a snowstorm out or if it's 40 degrees, right?
Exactly.
It's an important all year round concern for us women and men, in fact. Thank you for being here today.
Thank you very much.
Yes, Dr. Harpreet Lotay with Sona MD. And in fact, you can go online to sonamd.ca. But tomorrow night, 5:30 onwards, you can go and head over to their building and check it out. You can find that information on the website as well, sonamd.ca. We're back after a quick break. Stay with us.